So what's the state of dermatological treatment in the NHS? Are people with things like this or with SCCs, are they having to wait ages to see someone like yourself?
Yes. Bottom line,
that's
yes.
not terribly good, is it?
No, it's not terribly good. So the many years ago, any of you who have had a cancer scare will have heard of the 2-week wait system. If your GP worries you have a cancer, you get seen within 2 weeks. And they changed that a few years ago. People still know it as a 2-week wait, but it's now the urgent cancer pathway, because we don't have to see you in 2 weeks, we have to diagnose you in 4. That's a lot. That's so the time that from you seeing your GP to a diagnosis of cancer within 4 weeks, 28 days. Which is
you said that's a lot. That's a reasonably quick turnaround.
That's very quick, isn't it? That's a lot to ask, is what I mean. It's a lot to ask.
I see, yeah.
It's not too bad in my situation, because actually we are allowed to diagnose clinically. So if you've been seen in 3 weeks and I say you've got this, it's fine. But just imagine if you're going over to gastro and you've got to have your endoscopy and a biopsy within 28 days. That's a big ask. So there's a huge pressure on the NHS. And also the pressure on the GPs means that patients will be referred in with a lot more minor things. So if you're trying to get all of those patients, 90% of whom don't have cancer, to pick up the 10% that do, it's a huge resource. Dermatology, unfortunately, is very understaffed. So the government promised us an increase in consultant numbers about 10 years ago. That didn't happen. And we have 1/3 of all consultant posts in the country empty.
Why didn't it happen?
Well, we're going to have a political discussion about neoliberalism in the NHS. It's a cunning plan. I mean, dermatology is perfect privatisation, and I don't think it's happened by accident in any way. Several serial governments have particularly under-resourced the areas that will be picked off by private
I imagine that there are, for want of a better word, sexy areas of specialisation in medicine which pick up lots and lots of volunteers. I get the impression orthopaedic surgery is very popular and geriatrics is very unpopular.
Yes.
Where does dermatology fit in the popularity stakes?
Incredibly sexy.
Is it?
There's just no way to train in it because there aren't training numbers. So when you train in medicine, you have to have a training post. And so because there were 1/3 of consultant posts empty 10 years ago, we were promised an increase in training posts. That never happened. So if you don't train the registrars, because it's now so difficult, it's become less. But about 5 years ago, dermatology was the second most sought after specialty in medicine after cardiology.